Good morning, good afternoon, good evening, wherever you're watching us from. I'm Fitzroy Gate, and welcome. Today, we're having an important conversation around what happens after patients are discharged from the hospital. I have with me today Carol Royer. Carol is the Executive Director of Buddy Services Center for Seniors. Her work focuses on improving what happens after patients leave the hospital, particularly in the transition from hospital to home. She's currently expanding this work in Ghana with focus on strengthening post-discharge care and supporting patients and families during recovery. Her work has been also recognized internationally for advancing in-home senior care. Also joining us is Dr. Joshua Nkrumah Asante, a dental surgeon and principal dental officer at Interchange Dental, with over 6 years of clinical experience. He is also currently pursuing a fellowship in implantology. Dr. Asante, thank you for joining us today.
What we're really exploring today is what happens after patients leave the hospital, a phase that is often overlooked. We've done well clinically inside the hospital, but we haven't fully accounted for what happens outside of it. And that's where many patients begin to struggle.
The mouth is actually the gateway to the body. It's one of the gateways in the physical world. And everything we take in, your medication, your food, water, anything basically you need to survive apart from the air. And even the air comes through the mouth as well. It means that it is a means of transport for everything good and everything harmful as well. Making sure that that place is clean or adequate for health is very important. It's like one of the most important things you can do for health.
And what's really interesting is that a number of people don't consider that, right? So let's talk a little bit about, and we're talking specifically about seniors. So we have seniors who may have dentures. There's some of them who may have no teeth at all in their mouth, but there is still care that needs to be provided because we want to reduce infection. And I don't know if there are stats out there that tells us how many seniors get readmitted because, they get home with no proper instruction on how to care. Because medication, as you know, also can cause, different reactions and symptoms in the mouth. So let's talk about that a little bit.
Right. So when you look at the mouth of a patient, right, what you realize is that it's filled with bacteria. This is not to scare you in any way. Yeah, but we have something called the normal flora in your mouth. So normal flora is simply bacteria that inhabits less virulent. If I say virulent, I mean less dangerous bacteria that inhabits the mouth, and make sure that a more virulent bacteria, that's a more dangerous bacteria, doesn't inhabit the mouth and then cause an infection.
Right.
So usually the body has an immune system which usually fights diseases or can fight these infections. And because your immune system is adequate and strong and it's working perfectly, it makes these normal flora, these bacteria, very irrelevant. So they live there in harmony with us.
Right.
So if you don't take care of your mouth, what happens is that these virulent bacteria or these harmful bacteria get into our mouth and then they inhabit the mouth and then they start causing problems. And that decreases your immunity because your immune system has to do double the work.
Correct.
And then recovery becomes a problem. So your immunity goes down and then recovery becomes a very big issue. In this part of the world, we are not very big on stats, so we don't do a lot of research work. So I may be fabricating some stats for you if I should give you
Right.
that.
I hear you. But you mentioned something earlier. You talk about infection. So a patient is discharged from hospital. I'm giving you a scenario. A patient is discharged from hospital. They're now home. Oral care is not really being monitored at all or even being cared for. And then they get an infection. You talked about infection, pneumonia. Think about you're recovering from whether it's a surgery or some other ailment, compound with pneumonia because you can get pneumonia from, am I correct, from, the dentures or infection in the mouth.
So one of the bacteria that has been seen to cause pneumonia is streptococcus, and it's seen in great numbers in the mouth. If they grow in great numbers, and then they can start inhabiting other parts of the body, and then it makes your pneumonia worse. Also, with my earlier point that I made, when you have your immune system fighting diseases in your mouth, then you're left with less soldiers to fight
Right.
against your pneumonia, because drugs just enhance or boost your immune system so they can defend better with your body.
Right.
And another stat that is important that you may want to know is that you need to keep your mouth clean for adequate gum health every 48 hours. So you can actually, for you to have an healthy mouth, you need to do a lot worse, or you need to be doing so badly to have that.
Right.
But
Right.
yeah, I mean, that's basically what it is. If you don't even have teeth, you need to look for the alternate ways by which you clean your mouth, because the mouth is just not made up of the teeth. There are other tissues in there that also need to be kept clean as well.
Right, right. So that's very important because it highlights how recovery is influenced by factors that are often overlooked once patient leaves the hospital. So thank you for sharing on that because that's very vital to our clients.
The reason why I'm focusing on bacteria is that that is the main issue that happens in the mouth. So when you have a viral infection, right? Viral infections usually take 2 weeks for them to clear in the body if they are not progressing to cause other systemic diseases, right? But when we talk about bacteria, bacteria has a symbiotic behavior with us, right? So they take advantage of some of the things that we do have to survive, and we also take advantage of some of their qualities to survive, right? But so it means you're always going to have that kind of relationship with them. But the balance is what you need.
Correct.
So when you're released from the hospital and you are actually recovering from a systemic disease, or even if it's not a systemic disease or it's something from a trauma, maybe you're involved in an accident or something, your immunity is basically down, and you're trying to bring it up. So what you need to do is keep yourself in the best shape possible. Doctors tell you to take in a lot of fruits, taking your vegetables, to taking your vitamins, and all these things are trying to boost your immune system.
Correct.
Right. But what they are silent on, or what some people are silent on, is oral care, or is cleanliness.
Right.
Put it that way.
Right.
It's not just with the oral cavity, but even with your
Overall
general hygiene, right? That alone affects your recovery from the hospital and could actually take you back. Because imagine having a wound that you are not taking care of, it's going to get infected.
Yes.
And get you back to the
Yes.
hospital. So
Yes.
basically, that's what it is.
Yeah. Yeah.
One day I was in the consulting room, and a lady and the mom, very senior mom, came in and then had the dentures on, and no one had an idea how to take the denture out. When the denture was placed in, it's been left in there for God knows.
Oh my gosh.
Yeah, it's great. So this just goes to show you that seniors themselves, some of them are not equipped to know how to take dentures off and put it in there, and family members, usually because the senior has taken care of themselves for so long, they leave most of the responsibilities to them. And when they are even asked to come in, they totally don't have an idea of. So I had to re-educate the lady in how to get the denture off and get it in. Because the mom had like Parkinson's disease, so it was really shaking and couldn't stabilize her hand.
So I wanted to just add to that. Husband and wife living in a home. Um, like you said, they were independent, each taking care of their own selves. Now the wife becomes ill, and the husband now has the responsibility. And I have a client, this just happened this week, where now the husband is responsible for caring for his wife. Doesn't know how, like you just said, to remove the denture. Doesn't even realize that it needs to be clean and her mouth needs to be clean. So she ended up having an infection, and that's where we were called in because she was not eating. So, the husband thought she wasn't eating because she wasn't able to communicate that she's having pain in the mouth. And I sort of alluded to that earlier on. How important it is for us to educate family caregivers, because almost 99% of the time, the caregiving starts with the family until they become overwhelmed, and then they go external to look for, some, external help, a third party company to come in and support them in that area, because it is daunting for family members, because remember, they didn't sign up for this. They have no formal training in how to care, and now they're left with this responsibility to do so. So what are some of the some of the ideas that you can put out there, or suggestions, if I can put it that way, that to bring family caregivers into the discussion, saying, "Oh, I didn't know this. I need to take care of this."
So I think the first thing personally I do when I see seniors that are a bit incapacitated is to always see them with a family member. So that's what we usually do. The
Okay.
instructions are given to the family members.
Right.
Um, everything that they need to do for the senior is given to the family members. You know, the funny thing with seniors is some of them actually still want to do things but on their own.
Absolutely.
Yeah, they still want to
Absolutely.
remain independent and try to push away or go against any kind of help coming from people.
Yes.
But you just need to get through to them, let them understand that it doesn't mean that they are weak or it doesn't take anything from them. We're just trying to support them in the system the
Yes.
same way they supported us when we were younger.
Hmm.
And they need some form of help as well. So I think there's a little pushback from the seniors as well
Yes.
because they still want to.
Initially, because we've seen that in our own when we go into homes as well. Oh, I don't need your help. I don't need your help, because a family member would call us in, and we'll go in there and it's like, we're here to assist. Oh, I don't need any help. I don't know why my daughter sent you. And
Yes.
there's that initial pushback.
Don't worry, I have a 78-year-old dad. So
Right.
I get that.
Right.
I get
Right.
that totally.
But eventually, after a couple of weeks, we see where they become acceptable and they open to receive the care. And all of a sudden, it's like, yeah, they'll be like opening their mouth for you to take the denture out or whatever. Before, they were maybe embarrassed by it, or perhaps they, didn't, whatever their reason was. But we see them opening up slowly and slowly. And I think that's so important as well, too, that when a caregiver comes into the home, that they don't just try to take away the senior's independence. We slowly introduce things and we talk them through each step as we go, because they realize, or they know, that if they give up this independence, then now all of a sudden they become dependent.
Yes.
And we don't want that to happen right away. We still want them to be involved in their daily care. And I know we're talking to you about oral care, but there's so many other things, areas, right, that we don't want them to give it up. I have seniors who, they were accustomed driving themselves to their appointments, but now based on their medication, they're not able to drive anymore. And that's frustrating. And family members, they just want to cut, 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 cut. No, you can't do this, you can't do this, you can't do this. And it's true, but it's the approach behind it, right? How we do it.
I
Hmm.
also think there needs to be education because
Hmm.
generally dental education in this part of the world is inadequate. So we in the community are having to do a lot of education through the media, through individual, even one on one. So I think your your agency is like a brilliant avenue for us to be able to speak to some of these seniors
Right,
and let them
right. Yes,
understand the reason why sometimes people need to help them or even the reason why they need to take care
the
of
help,
their
right,
oral
right.
health
Hmm.
themselves.
Yeah,
So that's one way by which we can tackle some of these misconceptions and some of these inadequacies that we have in our system.
right.
Like it's of absolute importance to get your oral care right because we've seen a lot of things, right? So one interesting thing is that if you look at the stats, right, internationally, one of the ways by which people have seen that they've gotten the HIV virus is through the mouth
Hmm.
because there are a lot of manifestations. We have about 200, over 200 types of oral lesions that you can see in the mouth.
Wow.
And so because of that, you can't even diagnose an oral lesion through um, examination and your clinical skills. It just shows you everything that is happening in the body. So getting your oral health right is basically your health.
I bet you, Dr. Asante, that people are out there who are listening to this, they go like, oh my gosh, a discussion on oral health,
Yes, I
because it's
know.
not something we talk about often, right? But yet it's so very important. So what I'm hearing, across all of this, is there's a gap in continuity of care, because while they're at the hospital, there's certain care that's happening, but once they leave home, it's different. So especially once the patient leaves the hospital, so we see that continuity of care needs to continue post discharge.
So when it comes to oral health, we have two main diseases that affect oral health. So it's periodontal disease and dental caries. But for seniors, that doesn't really apply so much because they basically go through their whole life and now they face different challenges at that age. Usually, the challenge they face is wear and tear from all the years they've had teeth. So you see them lose a lot of teeth. You see them have their teeth worn down. You see them have their teeth broken. So those are the challenges that seniors have. So they have a lot of prostheses and dentures. But the problem with prosthesis is that when it goes into the mouth, then the cleaning needs to go higher because then you introduce something foreign to the mouth. And God in His wisdom has His own ways by which He helps us clean our natural teeth. But we don't have the wisdom of God, so we fabricate things that look like what God made. And because of that, we need to do something a bit more extra to make sure that those things stay in place and then you have them for a long time. So cleaning when you have prosthesis or cleaning as a senior is of the utmost importance and you can't let that down. Secondly, I know when it comes to dentures, it's a really touch and go area, and people are touchy about it. But you can't keep your dentures in your mouth all the time. Yeah, you need to take them out so the gum there can breathe, else you end up getting denture stomatitis, which causes an infection. And the problem with the infection is that when it gets into your blood, and then it becomes sepsis, and then it can kill you. So you don't want that. There is a pathway from an infection ending you to death. I know it's a bit strange, and I know some of you will want bridges and implants, but I mean it's always not possible. So please listen to your dentist.
So, you mentioned about it's not to be worn 24/7.
Right.
I understand that. But also, there's a lifespan on dentures. Is that
Right.
correct? So, you can't wear this indefinitely. Let's say you lost your teeth at 50 and now you're 70 using the same denture.
Right.
Talk to me about that.
I know people get a bit attached to their dentures, especially dentures you've worn for a long time, because a newly fabricated denture doesn't feel the same. It may look the same, but it doesn't feel the same as your old denture. But dentures do have a lifespan. Everything does have a lifespan. Even me, I do have a lifespan. So, um, really, dentures are dependent on the individual. I can't say it's 5 years or 7 years or 10 years, but you will know because it gets loose over time, it gets dirty, and it's uncleanable because I know everybody cleans their dentures, and sometimes it just doesn't work as well. It breaks and you lose a tooth and all that. So just try and change it from time to time. An adequate time is 10 years.
So, I'd like to interject here. So, it's easy for you to say that because you're the doctor, you're the dentist, right? But I'm a senior, I'm 70, 80 years old. I don't have the finances. And so it falls out every once in a while I'm eating or while I'm drinking a cup of water and it falls into the cup. But I've got dentures. Right. So what is the cost? Let's talk about cost factor because that's going to be a very important aspect for our seniors because finance is definitely an issue. We know that when I say we know that there's some individuals out there who don't have a pension because they did not work in their working years, or maybe they were on their spouse's pension, but the spouse passed away. So now there's really no money. And now you're saying I need to change this after 10 years.
Right.
Talk to me about that.
Right. So, firstly, dentistry is not cheap. If you're getting dentistry for certain amounts, you should be suspicious of what's going on there. That's the first thing I need to say. Secondly, for seniors, they are um, how should I put it? They are the part of society where we kind of take care of because if you are 70, I know you're retired, you don't have steady income coming in, you might not have a pension. So most clinics have special pricing for seniors. That's the first thing. There's a lot of payment plans as well for seniors to take the burden down. Um, I think the last thing that we do for seniors is pro bonos. So some clinics actually run pro bonos if they see that you are really in need and you really need it. I mean, some clinics actually do that as charity to get some tax off. So don't hesitate to visit a clinic. You never know what's going to happen there. But the step is important. The problem with dentures is that it falls under prosthesis or cosmetic work. So usually insurance companies don't pay for dentures and other cosmetic work. But there is a government insurance that when you take to government facilities, it's going to knock off some of the amount of
That's
money
good to know. It's good to
on
know.
the prosthesis that you have.
Well, for all the seniors out there, you've heard the doctor himself. There are programs out there. No, that's very practical. And thank you so much for sharing that information. It shows how something as simple as daily oral care can have a significant impact on overall health and recovery. What's really clear from the conversation is that oral care is not separate from oral health. It's a critical part of recovery, and it reinforces something we're seeing across different areas. Recovery doesn't end at discharge, it begins there.
The miles are far, feels like the battle is won.
Thank you, Dr. Asante, for sharing your insight with us today. We truly appreciate your time and your perspective on such an important aspect of patient care. Thank you again to our viewers for joining us in this conversation. It's clear that what happens after patients leave the hospital is just as critical as the care that they receive inside the hospital. And conversations like these are essential in helping us better understand and address those gaps. We would like to extend a gracious thanks to Agate Creative Studios and the team who painted this amazing picture. We'll continue to explore these issues by engaging with more healthcare professionals across different disciplines. If you are a healthcare professional and would like to be part of our ongoing conversation on post-discharge care and patient outcomes, we would love to hear from you. Please feel free to reach out to us. We are building a space for meaningful dialogue, sharing insights and practical solutions that can improve care beyond the hospital. You can contact us directly at 059-687-1506 or leave us a comment to join our conversation. We believe that improving patient outcomes requires collaboration, and we should never be too far apart to show a little heart. Thank you once again. I'm Fitzroy Agate, and we'll see you in the next episode.